Good day everyone. My name is Noe Joshua Estolloso, student from BSc 1-4. Today, I will discuss to you my topic about battered woman syndrome, postpartum stress syndrome, and postpartum psychosis. But first, I will read to you my quotation about by Sigler. People often say that motivation doesn't last. Well, neither does budding. That's why we recommend daily. Okay, let's start. First, I will read to you my objectives. Number 1, learn and define the theory of battered woman syndrome, postpartum stress syndrome, and postpartum psychosis. Number 2, determine the causes and effects of battered woman syndrome, postpartum stress syndrome, and postpartum psychosis. The third one, distinguish the difference between postpartum stress syndrome and postpartum psychosis. Number 4, identify the proponent of battered woman syndrome, postpartum stress syndrome, and postpartum psychosis. Number 5, explain the 3 stages and different abuses involved in battered woman syndrome. The last one is know the effect of postpartum stress syndrome and postpartum psychosis in the woman of society. First, we talk about the battered woman syndrome. Battered woman syndrome is a psychological term used to describe women who are stuck within or have recently left a violent relationship characterized by a cycle of violence. This psychological abuse degrades and humiliates the woman, thereby facilitating destruction of her self-esteem, and by implication, her moral personhood. She learns to be helpless as a survival mechanism so as to delay incurring the wrath of the batterer or decision maker or controller. Battered woman syndrome was being modeled after the post-traumatic stress syndrome by Vietnam veterans and later applied to people victimized by rape. Battered woman syndrome also refers as the Republic Act 9262, Violence Against Women and Children Act. Leonard Edna Walker was the proponent of battered woman syndrome. Leonard Edna Walker is an American psychologist who founded the Domestic Violence Institute, documented the cycle of abuse, and wrote The Battered Woman, published in 1979, for which she won the Distinguished Media Award that year. She was inducted into the Colorado Women's Hall of Fame in 1987. The reason why she published BWS or Battered Woman Syndrome because when she began studying violence against women in the 1970s, after working with children and mothers in the first part of her career, in 1979, she published the Battered Woman Syndrome to help raise awareness for domestic violence. And these are the 3 stages of Battered Woman Syndrome. The first stage is characterized by tension between the pair. During this tension building stage, relatively minor incidents increase the tension in the relationship and culminate in the eruption of violence. The next stage in the cycle of violence is the violent incident. The violence may be short-lived or last for a few days. Often, it is at this stage that police are notified or legal proceedings begin. The third stage is referred to as the honeymoon or loving contrition stage. During this time, the abuser is often very loving and remorseful. Promises or maybe be battered that he will not violently abuse the woman again. And these are the causes and side effects of battered woman syndrome. The causes are behavior brought on by victimization, learned helplessness behavior, and self-destructive coping behavior. And the effects are battering means more than just a physical assault. It means pain and injury from physical assault, plus continuous psychological degradation, sustained fear, diminished power and control. and loss of identity and self-esteem. And here is the case between Anna Landone and Kate Thompson that can be related in Battered Woman. The celebration of National Women's Month in the month of March in the Philippines was shaken by a high-profile case of violence against women involving two celebrities, actress Anna Landone and actor Kate Thompson. The Philippines has been observing National Women's Month as a way to celebrate, empower, and defend the rights of women. The high-profile case of Landone and Thompson highlighted the importance of awareness about women's rights and also the reality that there's still a long way to go before people unlearn and end the act of justifying violence against women or vow. The next topic that I had is postpartum stress syndrome. Postpartum stress syndrome falls somewhere between postpartum anxiety and depression and the baby blues. While more severe than baby blues, which is usually defined as feeling sad, moody, or cranky for a few days and up to 2 weeks after giving birth. Postpartum stress may be missed by the medical community because it is not as severe as postpartum anxiety or depression. Someone with postpartum stress will be coping, and outsiders probably cannot tell that something is wrong. And here are the causes of postpartum psychosis. Genetics studies show that having a family history of postpartum syndrome, especially if it was a major increase the risk of experiencing postpartum depression. The next one is physical changes. After childbirth, a dramatic drop in the hormones estrogen and progesterone in your body may contribute to postpartum depression. The next one is emotional issues. When you're sleep deprived and overwhelmed, you may have trouble handling even minor problems. And here are the effects of postpartum stress syndrome: anxiety, mood swings, sadness, irritability, feelings overwhelmed, crying, reduced concentration, appetite problem, and trouble sleeping. And the last topic that I had is postpartum psychosis. Postpartum psychosis is the severest form of mental illness in that category, characterized by extreme confusion, loss of touch with reality, paranoia, delusions, disorganized thought process, and hallucinations. It affects around 1 to 2 per 1,000 females of childbearing stage, and usually happened immediately within days to the first 6 weeks after birth. Risk factors include a history of bipolar disorder, history of postpartum psychosis in the previous pregnancy, family history of psychosis or bipolar disorder, history of psychoaffective disorder or schizophrenia, and discontinuation of psychiatric medication during pregnancy. And here are the causes of postpartum psychosis. History of mental health conditions. About 1/3 of people with PPP or postpartum psychosis have a previously diagnosed mental health condition. Next one is the number of pregnancies. Postpartum psychosis is more common in people who just gave birth to their first child. The next one, family history of mental health conditions, especially postpartum psychosis. People with PPP or postpartum psychosis often have family members with a history or related mental health conditions. Next one is sleep deprivation. Experts knows that not getting enough sleep can trigger mania in people with bipolar disorder. The next one is hormone changes. Your body chemistry during pregnancy undergoes major changes around the time of childbirth. The last one, other medical conditions. Psychosis can also happen for medical reasons, many of which are possible during or immediately after giving birth. And here are the effects of postpartum psychosis. Hallucinations, hearing, seeing, smelling, or feeling things that are not there. Delusions, thoughts or beliefs that are unlikely to be true. A manic mood, talking and thinking too much or too quickly, feeling high or on top of the world. A low mood, showing signs of depressions, being withdrawn or tearful, lacking energy, having a loss of appetite, anxiety, agitation, or trouble sleeping. Sometimes a mixture of both a manic mood and low mood, a loss of inhibitions, feeling suspicious or fearful, restlessness, feeling very confused, and behaving in a way that's cut of character. And here are the difference between postpartum stress syndrome and postpartum psychosis. Postpartum stress syndrome or postpartum depression isn't typically a medical emergency unless it is accompanied by thoughts of suicide is one of the imminent threat to themselves or others, while postpartum psychosis is more severe and considered a medical emergency due to risks it poses to the mother and baby. And to prevent postpartum psychosis is if you're at high risk of developing postpartum psychosis, you should have a specialist care during pregnancy and be seen by a pre-birth planning meeting at around 32 weeks of pregnancy with everyone involved in your care. That's all. Thank you.